Hi, how you going? I hope you're feeling as well as possible on your medicines. I'm Pharmacist Fi, and welcome to my YouTube channel and to episode 5 of our new series called What Went Wrong? Mrs. G had urge incontinence of urine, which means she felt a stronger need to urinate and did not always get to the toilet in time. This was especially nerve-wracking if she was at a nice lunch with friends, although she now wore special absorbent sanitary underwear just in case. Last week, Mrs. G's doctor offered her a medicine which is commonly used for urge incontinence, called Oxybutynin. This helped Mrs. G feel less urge and make it to the toilet a bit more often. However, Mrs. G started feeling tired and less alert, so much so that she started tripping over things and bumping into things more often than usual. She also felt her thinking was slower and it was harder to remember things. Plus, she had a very dry mouth and started getting constipation. Constipation is hard poos or poops which are difficult to pass. Worst of all, yesterday, Mrs. G nearly drove into someone because she was too vague to see them entering the pedestrian crossing, which was not at all like her, and this really scared her. Because Mrs. G did not know the possible side effects of Oxybutynin, and because the side effects seemed so completely different to the main effect of the medicine, she did not realise that they were side effects of Oxybutynin. But the next time Mrs. G was at the pharmacy, she did ask the pharmacist if any of her medicines might be causing these side effects. And sure enough, the pharmacist confirmed that the symptoms Mrs. G had been experiencing are all common side effects of Oxybutynin, which tend to affect people much more if they're over 65 years of age, like Mrs. G. So, for some older people, Oxybutynin's side effect risks, like increased risk of a fall or possibly a car accident, might outweigh the benefits in some cases. Unfortunately, there are quite a few medicines which carry the same side effect risks as Oxybutynin, not just medicines for incontinence. So if you or someone you know takes a medicine with these effects, my number one top tip is keep a diary of medicine benefits versus side effects by writing down any benefit you notice from the medicine. For example, for Oxybutynin, write down how many times per day or per week you experience a strong urge to urinate and then get urinary incontinence, which means to accidentally wee or pee, and how much this number of times has changed since you started the medicine, if it has changed, to help you and your doctor figure out if it seems to be helping much or not. Also, keep track of side effects, like how many times per day or per week you accidentally trip or fall or bump into things, or feel less alert while driving, or almost have a car accident, or actually have a car accident, or find it hard to remember names or what you did yesterday, or feel tired or confused, have a dry mouth, and have constipation. And take this diary to your doctor. Which brings me to top tip number 2. Don't try to make medicine decisions on your own. If you think you may have side effects from a medicine, contact your doctor as soon as possible to get them to help you weigh up the benefits of treatment versus any possible side effect risks. And take your diary from top tip number 1 to show the doctor to help with this discussion. And if any medicine changes are needed, ask your doctor exactly how to make the changes as safely as possible. For example, if a medicine needs to be stopped, should it be stopped gradually or immediately? And if gradually, how? Top tip number 3, get a CMI for each medicine you take and read the section about side effects so you know what symptoms to look out for and what to do about them if they happen. Please click the subscribe and like buttons below this video if you'd like to see more of these medicine safety videos. And Denver and I look forward to seeing you again very soon here on this Pharmacist Fi Medicine Safety YouTube channel. Thanks for watching. Bye. Denver, lie down. Good boy. Oh, that's a good lie down. Lovely dog. Good boy.